how to draw up testosterone. When you first receive your testosterone package, you will see your testosterone vial, the injection syringe, and the drawing needle. Just for some clarification, there are two parts to an injecting device, the syringe and the needle. When we talk about the size of the needle, we are referring to the gauge. The bigger the number, the smaller the needle. You will also see a length denoted on the needle, 1/2 inch, 5/8 inch, 1 inch, etc. When we refer to the syringe, we refer to the volume that it holds. Just to be clear, a cc and an ml are the same unit of measurement. So a 10 cc syringe is the same as a 10 ml syringe. So first we'll start with how to draw up the testosterone. This is the trickiest one only because you have to change the needles between drawing up and injecting. This is because testosterone is very thick, so it's easier to use a bigger needle to draw it up, and it's nicer to use a smaller needle to inject it. So first, make sure your hands are clean. If this is the first time using the testosterone vial, pop the plastic safety cap off of the top. Next, use one of the alcohol swabs to wipe clean the rubber center part on the top of the vial. Next, we are going to change out the needle. So first, unwrap the syringe and you're going to twist off the 25 gauge needle that comes attached. Set this aside. Now, take the 18 gauge needle, unwrap it, and attach it to the syringe, simply by twisting until it clicks or kind of squeals. Next, carefully uncap the needle. You'll take your testosterone vial, turn it upside down, and insert the needle in the center of the rubber cap. You're going to slowly pull back on the syringe until you get to the correct dosing for your prescription. So if it's 1/2 cc, it'll look like that. You're actually going to push the plunger just slightly above that mark before you pull out. Now carefully pull back on the syringe. That will take all of the extra testosterone that was in the needle out, so you're not wasting any. Now carefully recap the needle by placing the cap on. Twist off the 18 gauge needle and twist on the 25 gauge needle. Again, carefully uncap the needle. Now you're going to squeeze the testosterone up to the top, removing any air bubbles. You'll see the bubble come out the top and a little drip. That's going to help to lubricate the tip of the needle. If there's any extra bubbles, you can kind of flick the top of the syringe to remove those. Now you'll carefully recap the needle and you are set to do your injection.
This is an instructional video to guide you in safely and effectively injecting your hormones. This video covers how to give yourself a subcutaneous shot. A subcutaneous or sub-Q shot goes into the fat. It uses a shorter, smaller needle than a shot that goes into the muscle. Both estrogen and testosterone vials say for intramuscular use only, but it is okay to do a sub-Q shot with both of these medicines. Choose where you want to give yourself your shot. Good options include the stomach and thighs. You can also do a sub-Q shot in the back of the arm, but it's very difficult to do on yourself. If you want to do your shot in the belly, choose a spot that's in the highlighted areas and that is at least 2 finger widths away from your belly button. If you want to do your shot in the leg, you should choose a spot in your upper outer thigh. Next time you do your shot, you'll want to pick a different spot on your body to do the injection. That way, you aren't always poking yourself in the same spot. Repeatedly doing your injection in the same place can cause the skin to become thick and rubbery and not absorb the hormones as well. Some people choose to alternate between the right and left sides of their body, while others decide to do their shots in a circle around their belly button. We recommend writing down where you did your last shot or putting it in your phone because people often forget where they did their last shot by the time they need to do their next one. In between your shots, you should store your hormones at room temperature like in a drawer. You should not put your hormones in the fridge or leave it in the car during the summer. Also, try not to walk around with your hormones in your pocket for long periods of time.
To locate the correct injection site, first divide the area into quadrants. The correct injection area is Q2. Never inject anywhere near Q1. Now, place your foot behind you to take your weight off the side of the body where you will be injecting. Locate Q2, the upper outer quadrant of your glute muscle. Thoroughly swab the injection site with an alcohol wipe. Remember to keep the glute muscles relaxed by shifting your weight onto the opposite foot. Insert the needle into the injection site at a 90-degree angle, but don't inject the medication just yet. At this point, it's recommended that you aspirate the needle to be sure you haven't struck a vein. To do this, simply pull back the plunger slightly for a few seconds. If you see any blood in the syringe, remove it and select a different injection site. It is recommended that you use a new needle to avoid the possibility of infection. If the syringe shows no blood, you may inject the medication by pushing down on the plunger. Re-swab the injection site with an alcohol wipe. Then gently massage the area for 30 seconds. After injecting, discard all injection materials properly. Dispose of syringes safely in a closed container.